you give three ampoules. It's only when the patient is less than. So when the patient has 2.0 to 2.5 milliequivalent, you give 3 ampoules. If the patient now has less than 2.0, you give 4 ampoules. And never pass potassium ion directly. Always place potassium ion inside glucose 5%. That glucose 5% that you have to pass 24 hourly. Is it clear? Never pass potassium ion directly, else you're going to cause a sudden cardiac arrest. So those are the different things that you have to put in your. So you have 3.0. If you are 3.0 to 3.5, just give 1 ampoule. 2.5 to 3.0, give 2 ampoules. 2.0 to 2.5, give 3 ampoules, and less than 2.0, give 4 ampoules. So the maximal dose is 4 ampoules. Is it clear? So those are the different things that you have to evaluate in mind. So after having so after visualizing the principle of management, you now visualize now the cause. You need to treat the cause. Is it clear? You have said that the cause can be any of the, when you have a respiratory system pathology, you now give amoxicillin clavulanic acid, provided it is a typical germs that has resulted to it. If it's atypical germs, then you give your macrolide. Is it clear? So provided it is respiratory system, you give amoxicillin clavulanic acid for typical, or you give macrolide for atypical germs. See, integumentary system, you give your cloxacillin. Is it clear? Provided it is Staphylococcus aureus. Is it clear? Now for the other ones like the urinary tract, you have to give either your fluoroquinolone. Is it clear? You give a fluoroquinolone, you give a third generation cephalosporin. If you have infection level of the GI tract, you give metronidazole. Is it clear? Particularly if particularly if there is mucoid stools, because mucoid stool and with tenesmus most associated with entamoeba histolytica, you give metronidazole. Is it clear? And you can give also a third generation cephalosporin that is going to target Escherichia coli, that is also there. And if the patient has enterococci, you can also give gentamicin. Is it clear? So those are the different things that you have to involve them. Now after the respiratory, so those are for respiratory system. So you treat the cause. You have already, when you have treated the cause, and it also, we can also, the cause can also be malaria. Never forget malaria when you're in endemic zone. Is it clear? And when the cause is malaria, always ask for malaria parasite and treat for malaria. You treat malaria by using 2.4 milligram per kilogram H0, H12, H24 of artesunate. Is it clear? You can also use artemether. Artemether, you're going to use loading dose of 3.2 milligram per kilogram, and then the maintenance dose of 1.6 milligram per kilogram. Is it clear? The maintenance dose is after 24 hours. So those are the different things that you have to do here. And with the maximal of 3 to 4 ampoules, is it clear, of 80 milligrams of artemether, while the ampoule of artesunate is 60 milligrams. So those are the different things that you have to put in mind. So after treating the cause, you now go to treating the complication. Is it clear? We already in doing the fluid rehydration in the principle of management, we already treat the complication, that is dehydration, because dehydration is a major complication that we have here. Is it clear? You already treat the cause, that is dehydration. Now also treating the background. The background is diabetes mellitus. Is it clear? Treating the background is diabetes mellitus. Now how you, in treating the to prevent the reoccurrence, you have to counsel the patient such that the patient takes his glucose level every morning and evening. Is it clear? Now to prevent again to treat it, so you have to also counsel the patient that the patient take his treatment. Is it clear? You need to know that in type 1 diabetes, the patient has to take regular insulin morning and evening, while in type 2 diabetes, the patient has to take oral hypoglycemics, provided that the patient is only having insulin resistance. But if the patient is already at the state of insulin deficiency, if the patient is already at the level of insulin deficiency, now the patient needs to take insulin. So you counsel the patient for blood glucose level control and also to take the hypoglycemics. Is it clear? So counseling also on that to prevent the reoccurrence. The next one, you have also to always counsel the patient also on there are certain prophylactic antibiotic therapy that the patient has to take, because he's always at the risk of having such infection. And also you have to counsel him such that he should always has to check himself every month. Is it clear? And then the last one is a rendezvous that you have to have with the patient after 7 days. So all that is to prevent the patient from having reoccurrence. Now the next thing after this now is the follow-up of the patient in the ward. So how do you follow up the patient in the ward? So you still follow up the all what I've said. You follow up the disease. you follow up the disease, you follow up the cause, the complication, the background, and then so those are the different elements. Or you have also if there's any prognosis for diabetes, you follow up that prognosis. So when you follow up anything, you use the means of follow-up. Is it clear? And the means of follow-up is divided into clinical and paraclinical. Is it clear? Now, clinically, what does the patient present as symptom? Is it clear? So you follow up that symptom. If the patient presents with confusion, you ask again if there is confusion the next day. Is it clear? And when you are doing this clinical and paraclinical, generally clinical is with the mnemonic SOAP. In the follow-up, at the end of the follow-up, you must have the SOAP, which is objective, subjective, you have objective, you have assessment, and then you have the plan of the day. That is the element that you must have in a follow-up, the SOAP mnemonics. Is it clear? So clinically, what should you have? So clinically, you assess for the signs, the symptoms that the patient have. If the patient came with confusion, he came with convulsion, he came with loss of consciousness, assess it. But objectively, clinically and physical examination, what are the signs? You can ask for a Glasgow Coma scale. Or you can ask for a Glasgow Coma scale. You can visualize for any other thing, mostly Glasgow Coma scale. If the patient, at the general state of the patient is still agitated, is sweating and all that, so that you can do clinically to assess for the disease, for the hyperglycemia, assess for the Kussmaul breathing, assess for all those things that the patient presented with, that you have already said clinically. And now paraclinically, you can now assess for the random blood sugar. Is it clear? Random blood sugar is taken during the day, while the fasting blood sugar is taken at night. Is it clear? And I've forgotten that also in the management, you must always tell the patient to control his diet at the level of the management here. Is it clear? To treat diabetes, you control the diet. Is it clear? And the patient should take food still containing glucose, but it should contain less of glucose load. Is it clear? So things like tubers food like yam, cocoyam, the patient can eat, but things that which are most highly sugary, they are going to release their sugar, the glucose very fast in blood. The patient should not take it, like sugary food and chocolate, all that. The patient should not take it. So a dietary control has to be done by a dietitian. So you assess for the disease. So for the cause, you have to visualize if there is any sign for consolidation in the lungs and all that when you do the follow-up of the cause. You now do the follow-up of the complication, which is dehydration. You have to look for signs of dehydration. And the signs of dehydration, you already know: sunken eye, you have oral mucosa is going to be dry, is it clear? And then you have abdominal skin turgor. So all that the patient have. And also another sign of dehydration is central nervous system sign, that is thirsty. Is it clear? And even confusion and loss of consciousness can be also signs of dehydration. So all those are the different signs that you must always evaluate. And from here we are finished with all the disease of diabetes mellitus. We say thanks for your attention. Please don't forget to like and subscribe for our channel, SchrDbb. Thank you.